Hi, everybody. Thank you so much for joining this webinar on transforming healthcare waste with us. So to start this session, I just want to share a little bit about healthcare waste. The World Health Organization has reported that waste management in the healthcare sector to be a growing problem. Today, 30% of healthcare facilities and 60% in the least developed countries around the world are not equipped to handle existing waste loads, let alone the additional COVID-19 load. This potentially exposes health workers to needle stick injuries, burns, pathogenic microorganisms, while also impacting communities living near poorly managed landfills and waste disposal sites through contaminated air from burning waste, poor water quality, and disease-carrying pests. Measures to ensure that the safe and environmentally sound management of healthcare waste can prevent adverse health and environmental impacts from such waste, including the unintended release of chemical or biological hazards, including drug-resistant microorganisms into the environment, thus protecting the health of patients, health workers, and the general public. My name is TJ. I'm the Program Officer of the Sunway Center for Planetary Health. On behalf of the Center and in collaboration with Healthcare Without Harm Southeast Asia, we hope that this webinar will start a conversation, a necessary conversation about our current practices in healthcare waste disposal and to encourage hospitals all across Southeast Asia to adopt sustainable practices. We have launched a social media campaign and we do hope that all of you will also participate in this and share the practices that you have. We will start today's dialogue with a keynote speech from Professor Agamuthu Pariyathambhi, a global expert in solid and hazardous waste management. He is a senior professor with 47 years of experience in the Jeffrey Sachs Center on Sustainable Development and the Associate Dean of Research and Postgraduate Studies at the School of Interdisciplinary Sciences, both at Sunway University. He is also recognized in the global top 2% of environmental scientists by Stanford University. Professor Agamuthu, the floor is yours.
Okay, can you hear me?
Loud and clear.
And can you see my slides now?
Yes, I can.
Okay, thank you. Okay, good afternoon. I hope my transmission will be clear and without interruptions. I just arrived in Singapore for a workshop for 4 days. So I just managed to get into the room now. Okay, I want to sort of start with something very simple. That is to tell what is the what do you mean by healthcare waste, and where are we in terms of the status of managing the healthcare waste, and what are the challenges. You'll see that we have actually a lot of challenges in the managing healthcare waste, which is classified as one of the hazardous waste, and we have a serious issue here because of the quantity as well as the lack of separation. So to start with, what is healthcare waste? And actually, basically, this is the waste that is generated in any health procedures, facilities, institutions, and so on. And any other waste that is produced during the healthcare procedures at home, even if it is you're checking your glucose level or dialysis and injections. So, but the irony is almost 75 to 90% of the healthcare waste is considered general waste. That means it is actually non-hazardous. And only about maximum 25% is hazardous, infectious or toxic, and I will come to that later. So what I'm trying to imply here is that we have the opportunity to do some serious source separation if we really want to minimize the amount of healthcare waste and therefore control the amount of waste that goes for incineration. Now, if you look at the impact of healthcare waste, 5.2 million people, that includes 4 million children, die each year from unmanaged medical waste-induced diseases. Of course, this is mainly from developing countries, but this number is very staggering, very frightening. More than 5 million people are dying, something to do with unmanaged medical waste-induced diseases. Okay, how much medical waste are we generating? It's also glaring to see that developed countries produce about half a kg per day per bed of hazardous waste. I mean, when I say hazardous waste here, I'm referring to medical waste. And in developing countries, the average figure is about 0.2 kilograms per day per bed. and what is happening is that in the healthcare waste generated globally is increasing every year by about 2 to 3%. So this is the what you call this part that we need to worry about. And here I have the data for the healthcare waste generation in terms of the various countries. And I will not go through every graph, but if you look at that, the biggest culprit, of course, is the United States, where they are actually generating more than 8.4 kgs per bed per day. So, of course, and then the second highest is actually from Canada. And if you look at the Asian region, of course, Kazakhstan seems to be generating about 5.4 kilograms per day, per bed. And of course, Malaysia, you can see that we are about 2 kilograms per person per bed. So, I mean, global average, we are not that bad, actually, in terms of the waste generation. And the hazardous waste treatment, of course, the largest amount of waste treated is in Germany, but this data is more for Europeans, and so maybe I'll just go on. And now, what are the types of hazardous waste we are talking about? Okay, so we have sharps. I think this is basically the hypodermal injections and the incision knives and so on. Then we have infectious waste, which we are worried about because this is usually pathogenic, or it can contain infectious material like contaminated blood and other bodily fluids and so on. So this is what we need to seriously separate from the non-infectious waste. Then we have pathological waste, especially human tissues and organs and so on. And then pharmaceutical waste, of course, this is the upcoming area because I don't know, many of you may actually collect the medicine for say 4 days or 5 days. And if you feel okay after 2 days, what do you do with the remaining pharmaceutical material? This is the issue that is coming up. And not many people take the trouble to go back to the hospital or clinics to return the medicine. So this is an issue. And then we also have, yeah, it's not moving. Okay. Why is it not moving? I'm sorry, the slide is not moving.
Professor, can you try using the arrow keys to move the slides?
Yeah. I'm not so.
Yeah, I think you set it to not taking mode.
Yeah, yeah, but
or something.
Why is it not moving?
I think perhaps if you try moving out of slideshow mode and come back, that should reset the slide.
Okay, let me try. Sorry about that.
No worries at all. Technological challenges, like all of us. Professor, can you try pressing escape?
Okay, now let me see. Okay. Yeah, can you see now? I hope it moves now. No, it's not moving.
It hasn't moved for us yet.
Yeah, but at least I can move it from the left side. Okay. Okay, so I was talking about the different types of waste category. And here we are looking at cytotoxic waste and clinical waste, which is actually lab reagents and film developers and so on. And then lastly, radioactive waste. So the non-hazardous or general healthcare waste, that this waste actually does not pose any particular issues unless we actually do the source separation. So I already mentioned this earlier, that 80% of the waste, clinical waste or healthcare waste collected is non-infectious. Oops.
Professor? Can you try
What
sharing the
happened?
screen again?
I share again. Let me see. Okay, share screen again.
We can see your browser.
Yeah, but
Can you try stop sharing the screen and share the PowerPoint?
okay, let me go out.
Yeah, I think it's best we resolve the technical difficulties so that the rest of us understand what we are speaking about. There we go. Thank you so much, Professor.
Yeah, but it doesn't move, but it's okay. I can use my left. Okay. So these are, as I mentioned earlier, these are the infectious waste. 80% is non-infectious, and then we have only 20%, which we should worry if we are separating the waste. So the examples of non-risk healthcare waste, like glassware, construction waste from the hospital area, paper, plastic, biodegradable waste, particularly the food waste and so on. In fact, food waste is one of the largest volume of waste generated in a hospital. And as long as it's not mixed with other medical waste, it can be taken to a normal waste treatment plant. And these are the risky healthcare waste, like radioactive waste and infectious waste, pathological waste, sharps, and so on. Okay, so I think we are familiar with all these things. These are some diagrammatic materials: biodegradable waste, the food waste, non-biodegradable, the risky waste, pathogenic, infectious, sharps, and so on. Then we have infectious waste, particularly those that has got bacteria and virus and so on. Pathological waste, which is after the surgery, and then we have sharps, and then we have radioactive waste, especially from the radioactive labs, X-rays and so on, and also the unused liquid from radiotherapy or contaminated glass waste. And these are the genotoxic waste, which are actually material that can affect the DNA structure of the cell, which is quite dangerous, of course. And then we have waste with high content of heavy metal, like batteries and broken thermometers and so on. And then pressurized containers, gas cylinders, gas cartridges, and then chemical waste like sodium hypochlorite used for the sanitization and so on. Then pharmaceutical waste I mentioned earlier, expired medicine, leftover medicines and tablets and so on. All these comes under the healthcare waste. Okay, now generally the healthcare waste system that we are looking at is waste is generated has to be segregated. This is the fundamental requirements of waste management, especially for clinical waste. And then the risky waste, of course, goes for depending on the various nations' priority. Like in Malaysia, of course, bulk of the clinical waste actually goes for incineration, but there are other countries where they actually have initial sterilization before it goes for incineration. If they don't have incinerators, they do sterilize it using other methods of chemicals, and then they go to a special landfill. And the non-risky waste, like as I mentioned earlier, like plastic, metal, and so on, of course, it can be considered for recycling. In some cases, this may require some kind of sterilization before it goes for recycling. Okay, so this is the kind of general scheme of waste management we use. And waste segregation is very, very basic or very important. As I mentioned, 80% is non-clinical waste, which could be sent for recycling if we don't actually contaminate it with pathogens. So these are some of the systems we do nowadays. So different categories of waste, we usually use separate containers. I'll come to that in a few slides now. Some of you may be familiar with the different colors. So it's a key to minimization and management of healthcare waste. And to my knowledge, I think Penang is the only state in Malaysia that has already initiated the waste minimization and clinical waste recycling activities to a large extent. And of course, other states are now trying to follow Penang in that sense. So it's a responsibility of the waste producer to ensure that the segregation is done at the point of generation. Because once you pack it, you cannot unpack it, because most of these containers are what you call safety locks, and then you can't open it once it's locked, and then you send for incineration. Okay, so this is the situation we are looking at. Waste collection, of course, like in Malaysia, it is very established. The waste collection is done by the 7 or 8 concessionaires that given the authority to collect waste with their specialized containers or transport facilities they have. And waste is collected. Once it's collected, it is taken for the various treatments like incineration. So I'll come to that later. Now, I mentioned earlier, it's very important that we separate the waste, and usually we use the color coding containers. Like, for example, green is non-risk biodegradable. This could be basically the food waste. As I mentioned earlier, in one of our pioneer studies in UNIS Hospital, we found that food waste is one of the largest volume of waste that is generated in the hospital. So this is given the green container. The dark blue container is for non-biodegradable, which can be recycled. So this is what Penang is actually aiming for. The black is for paper items, and then we have brown. Brown items, this contains blood fluids, and so on. Of course, this is hazardous. This is already hazardous, and it needs to be properly treated. Then we have red, pathological waste, sharps, pharmaceutical waste, cytotoxic waste. All these we use red containers, because we know that this cannot be done anything except incineration. So it has to go to the red container. And lastly, the yellow box is for any dangerous material like waste which has got a high content of heavy metals, batteries, or pressurized containers. We put them in yellow. So we can see that the color coding is very essential for people to separate the waste so that it doesn't get mixed up and doesn't contaminate otherwise. When it comes to storage, most of the facilities, the waste concessionaires, they do have cold rooms. They have cold rooms to facilitate them to temporarily store the material that is taken. But let's say during COVID, some of the countries experienced more than 100% increase in the healthcare waste. And I think one of the Middle East countries saw a 1,000% increase in the healthcare waste generated. So you are not ready for this kind of sudden increase. And what happens is you have to keep it in the cold room, freezers. And fortunately for Malaysia, we were able to manage it because the cold rooms were able to absorb the extra waste that was generated during COVID. So they keep it temporarily storage, and then they send it for incineration, which will be the next door. And so these are some of the practices in other countries. You can see that, sometimes we are a bit worried that whether the waste collection is actually done properly and at the risk of the waste collector. And then, of course, transportation, we have specialized lorries that are licensed to actually carry this waste to the designated incineration or special landfill area. And these are some of the final treatment of healthcare waste. As I mentioned earlier, some countries, they actually use this incineration. But before incineration, some countries used microwave and autoclave to sterilize the pathogenic materials before they actually send it for incineration. Okay, so these are some of the techniques that we use for waste treatment and disposal: biological procedure, autoclave, chemical disinfection, encapsulation, sanitary landfill, incineration. Now, let me go through this quickly one by one. The biological procedure, some countries, they use enzyme mixture to decontaminate the healthcare waste, and water is removed from the resulting byproduct. This one requires the regulation of temperature, pH, enzyme level. Because we use enzyme means it's a bit expensive, including aerobic or anaerobic digestion and so on. Composting, not many countries actually uses composting except for food waste. Okay, so other things we can't talk about composting. Autoclave, very common in many developing countries. They steam sterilize, they under pressure, and the material is made non-infectious, and therefore it can be actually technically thrown into a special landfill, not a sanitary landfill. This special landfill, like for example in Malaysia, we have only one special landfill in Bukit Anas. these are landfills which can accommodate hazardous material. And autoclave, of course, chemical disinfection, yeah, it is also possible. Like, for example, we can use 5% sodium hypochlorite or 30% hydrogen peroxide. This is also one option to make the materials pathogen-free. Encapsulation, of course, here we are talking about the materials which are more like powdery. We usually mix it with the cement. Maybe sometimes we add activated carbon and so on, and then we solidify it, and then we can put it in the landfill. And secure landfill is, some countries call this a special landfill. And these are landfills specially designed with at least 2 bottom liners, so that if there's any leakage in the leachate, it will not contaminate the soil. And as I said earlier, we have only one secure landfill in Bukit-Nanas, specially meant for hazardous waste disposal. But as I said earlier, Malaysia does not send all the hazardous waste to the integrated center. It sends it to incineration. And after incineration, the ash is sent to the secure landfill in Bukit-Nanas. Of course, incineration is one of the best option for medical waste, where we use combustion at a temperature of about 900 degrees centigrade. And this is one of the best options to volume reduction as well as making the material inert. And the non-incinerable waste, like for example, pressurized containers and so on, we have to send it directly to the special landfill. Inertization is quite similar to solidification. So here again, we take the waste, mix it with some lime, calcium oxide, cement, and water. And then after curing, usually it's cured for 21 days, it becomes solid. And then this solid is actually arranged in the special landfill. So what are the issues that we are actually worried about? Now, this slide is one of those I like. Not because it's something fascinating, because you're looking at waste pickers. Now, what about the medical issues of waste pickers? And on this example you're looking at is the Payatas landfill, where people don't even have the basic facilities with hand gloves and so on, but they're rushing to collect the recyclables. And nobody actually worries about their health. This is the issue. We have, like, for example, in India, 1% of their population of 1.3 billion people are actually involved in informal waste recycling. This is another issue that I like to highlight as one of the healthcare issues of the waste, because it's not really considered by many countries, especially in developing countries, because developed countries don't have informal waste pickers, and they are a different high level. Okay, now is this the right technique? You see, people are just simply removing the tubes, without any concern about their safety. And then this child is playing with the syringe, and then here we have the disposal of syringes haphazardly. Is this the right disposal? Of course, definitely this is not the right disposal. And then is the right site? Although we don't see clinical waste in Malaysian landfills nowadays, but occasionally we have some unscrupulous clinics which may dispose the clinical waste mixed with the municipal solid waste. Then you may find this, although it's not a common practice in Malaysia. And is it the right process? It's all mixed up. It's a really mixed waste, very difficult to separate, and everything is contaminated. So we are coming to sustainability of healthcare management. Sustainability here, I'm talking about healthcare, is shifted from an environmental concern towards a holistic approach of balancing socio, ecological, and cost efficiency of health services. So now, economic models have changed from the linear take, make, dispose to circular models based on recycling and upcycling that have the goal of keeping products, components, and materials at their highest utility and value. So this is, I don't want to go into circular economy, but here I'm only talking about circular economy of clinical waste. So here we are talking about supplier gives the raw material, manufacturers and distribution, and then healthcare provider. These are the hospitals which should seriously consider waste separation, so we don't dispose everything. Some of the things, they go back to the supplier, and this is what we mean by the EPR, extended producer responsibility, which is part of the zero waste option that is supposed to be in practice for waste reduction. It doesn't matter whether it is clinical waste or it's a municipal waste. I think it's very essential that we follow circular practice. And what are some of the issues of unsustainability? Pollution, solid and liquid waste, mixed acid rain, public health. We saw one good example of the informal sector just now. Global warming. This comes from most of the material that can release carbon dioxide, or especially from the food waste. Ozone layer depletion and loss of biodiversity. And of course, I don't want to elaborate more. I think most of you know the effects of pollution on health, challenges in waste management in Asia. We are talking about healthcare co-mingle with municipal solid waste. We have lack of sufficient and dedicated healthcare waste management treatment and disposal facilities in the poorer countries like Laos and Cambodia and so on. Lack of stringent enforcement of the legislation, lack of public participation and attitude, which is always a problem. So WHO highlighted that 3 out of 10 healthcare facilities do not handle the healthcare waste safely. So this is, something that we need to seriously take note of. And these are the 3 R's which normally people talk about in municipal solid waste. Of course, it is applicable to the clinical waste also. And lastly, for the continuous growth of healthy and hygienic cities in a sustainable manner, it is imperative that the country must improve its healthcare waste management system. So basically, we are talking about source separation. Yeah, spread of diseases and environmental pollutions could be minimized if we can actually implement the waste reduction. So inclusion of the informal recycling should be more investigated. So I always advocate that the informal sector should be formalized. As I mentioned earlier, 1% of India's population is involved in informal waste recycling. We have thousands of people in Indonesia, in Philippines, and in Thailand involved in informal waste recycling. And many of these people are actually taking the highest risk to earn a small sum of income, but they are taking the biggest risk in their life. So in general, participation of all stakeholders is significant to successfully enhance the healthcare waste management system. Thank you very much. And once again, my apologies for the technical issue.
Thank you very much, Professor Agamuthu, for those insightful comments and clearly setting the tone for this session, emphasizing the need for us to deal with healthcare waste in a manner that is sustainable. For those that have just joined us, this is a friendly reminder to please rename yourself. We would love to know who you are, and to also include your institutional or organizational affiliation in your name as well. So throughout this session, if any of you have questions, please feel free to raise them using the Q&A function in the Zoom chat. So the chat is disabled for everyone, but the Q&A function is open. So during the sessions, our speakers will answer questions, and the questions, once it is answered, will be visible for everyone. So now let's move on to the next part. I'm very happy to introduce our very first webinar speaker, Dr. Michelle Reyes. She is a registered pharmacist and medical doctor, currently working in Healthcare Without Harm as a healthcare waste sustainability officer. She is currently working on a project in partnership with her nation's Department of Health on the policy compliance of the Philippines COVID-19 Emergency Response Project, or PSERP, on healthcare waste. She will be speaking on overcoming challenges for sustainable healthcare waste management in Southeast Asia, the case of the World Bank and the Philippine Department of Health. Dr. Mitch, we eagerly await.
Hi, good afternoon, everyone, and thank you for that introduction. Let me just share my screen. Okay, can you now see my screen?
Yes. But it seems to be cut in half.
Okay.
All right, yes, we can see now. Thank you.
Okay. So I'm going to discuss about the challenges and the impacts if we don't address these challenges in sustainable healthcare waste management in Southeast Asia, particularly in what we are doing in the Philippines. So according to the IPCC report, is that all regions, especially in Southeast Asia, are projected to experience further increase in hot climatic impact drivers and decrease in cold climatic impact drivers. And at 1.5 degrees Celsius global warming, heavy precipitation and associated flooding are projected to intensify and become more frequent in most regions in Africa and Asia. So in Southeast Asia in particular, it has been reported as one of the world's most vulnerable regions to climate change. And it stems from the fact that we are located along the coastline, which have a high concentration of population and economic activities. And in addition, the vulnerability of the region comes from high exposure to climate hazards manifested in the different natural and man-made disasters that we are experiencing right now. And in terms of achieving sustainable healthcare, there seems to be a lacking of capacity for planning and action on climate change adaptation on local government in some Southeast Asian countries, such as in the case of Vietnam, Cambodia, and the Philippines. And these deficits have delayed the progress in terms of the activities and initiatives. So in this slide, the projections wherein the growth in emissions are projected to increase threefold. So the first wedge here represents the commitments made by the nationally determined contribution meeting the Paris Agreement commitments to reduce the healthcare emissions growth by 70%. And the next wedge represents the further or additional actions that we need to take to reduce emissions further. And we still have further to go in the wedge called uncharted territory, and we need to explore further and deepen our actions. So the roadmap highlights 3 pathways and 7 high-impact actions, which are interrelated. So the first pathway is what the healthcare sector needs to do within its own operations, clinical services, and facilities. While the second is what the supply chain can do by making sure healthcare products are zero carbon. And third is making sure that the wider economy and society match the same pace of reduction across agriculture, energy, transport, and housing infrastructures, because these all will influence the healthcare sector footprint. Now let's proceed to the 7 high-impact actions which contribute as modeled by the 44.8 gigatons by 2050. So first is renewables, which is the cornerstone action, buildings, travel, food, pharmaceuticals, and we should also implement circular healthcare and sustainable healthcare waste management. And of course, we need to implement their effectivity. So in the municipal solid waste composition in the report by the United Nations Environment Program is that in Southeast Asian countries, plastics range from 10% in Vietnam to 17.75% in Myanmar. And among the 4 ASEAN countries with updated hazardous waste inventory, such as Malaysia, Philippines, Singapore, and Thailand, the highest generator is Thailand, followed by the Philippines, then Malaysia and Singapore. And overall, the waste management profile and technology assessment in ASEAN region indicates that waste management technology is emerging from low end to high end, though there is a need to augment recycling rate to reduce the pressure on disposal options. So as we can see here, all ASEAN countries except for Cambodia and Laos have recovery or recycling facilities. The level of these facilities range from small and basic material recovery facilities to high-end facilities. And healthcare waste is treated and disposed in the majority of ASEAN countries by incineration also. So what are the initiatives of Healthcare Without Harm to address these challenges is we have different programs such as the Race to Zero by reducing it by 50% by 2030, covering all scopes of fair share. And we also have visited the COP26, wherein more than 40 nations have pledged to cut emissions across healthcare systems, and Laos, PDR, and Indonesia commits to the health program. And there are also other initiatives by Healthcare Without Harm, such as SHIP, and our toolkits in plastics and health, the GGHH or Globally Green and Healthy Hospitals, Climate and Health, and others. So GGHH is a worldwide community of hospitals, healthcare systems, or organization dedicated to reduce the ecological footprint of healthcare operations. So these are like the best practices the hospitals can share with each other. wherein our next speakers can also discuss further on this. So they have 10 sustainability goals, such as leadership, chemicals, waste, energy, transportation, water, food, pharmaceuticals, buildings, and purchasing, which are all interconnected towards the sustainability goals for the hospitals. And with the goals of the GGHH, these are the awareness raising and knowledge sharing, and we also have different resources and tools development, capacity building, and policy development, and especially network building by the different hospitals. These are the following tools that we also have. Okay, so here we also have RISE, which we mobilize the healthcare leadership for climate action and resilience and healthy recovery in Southeast Asia, wherein we have over 100 individual allies composed of healthcare professionals, hospital administrators, health and environment educators, and advocates. So we have the different manifesto where you can see here in this link to join. Now let's proceed to the initiatives wherein we focus on the plastics in healthcare and the project that I'm working on, which is the policy compliance audit by the different tools that we use, such as the self-assessment checklist, focus group discussion, and key informant interviews in 26 healthcare facilities all over the Philippines. So even though we have significant advancement in medicine and improved sanitation and sterility, made possible by the breakthrough of plastics production. So, and also because of this, plastics are heavily relied upon the healthcare industry. And it is widely believed that alternative materials may not be as effective as plastics. So because of this notion, we cannot completely eliminate plastics, which led to an exponential increase in the global plastics production with an annual production volume of 460 metric tons in 2019, which is a 230-fold increase from the 1950s, and we will be on track to triple by 2060. So this led to a ticking bomb even before the pandemic, and we also seen the challenges and problems during the pandemic, and even after that we have the vaccination right now. So the entire life cycle of the healthcare waste, including plastics from extraction, transportation, refining, and manufacturing, is generally associated with risks to human and planetary health. So in the healthcare settings, there are many unique and specialized devices, and some of the more common products such as syringes, gloves, and personal protective equipment, or PPEs, come from fossil fuels. And to improve the performance of these devices, plasticizers, flame retardants, fillers, colorings, and modifiers are added, which contain an addition of 80% hazardous chemicals. So it is worth noting that aside from the health impacts to us and to the communities surrounding the hospitals, it is also worth noting that coal miners, oil workers, gas field workers who extract the fossil fuels for the plastics production experience also an alarming increase of mortality rates due to the diseases such as pneumoconiosis, silicosis, cardiovascular diseases, and pulmonary diseases, and cancer. And because plastics are not generally biodegradable, thus human health impacts include the damage to our health. So we also have another concern, which is the microplastics because of their ubiquity and their size. Hence, they have the potential cost to harm our health through the entry in our human body by inhalation and ingestion. So pharmaceuticals are one of the primary sources of microplastics, while other sources include deteriorating plastic product and byproduct from waste incineration and landfills. And for the longest time, all plastic waste management technologies such as incineration, co-incineration, gasification, and pyrolysis have been associated with the emission of toxic pollutants, instack gases, ashes, and other residues. And these pollutants include lead, mercury, and organic substances such as dioxins and furans, leaching into our soils and water, leading to direct and indirect exposure to the patients, workers, and communities. So these methods of waste disposal have the potential, of course, have the potential risks to both human health and the environment, right? And incinerating products not only harms the environment and health, but it also causes a loss of valuable resources that are used during the production. And then here are the policies that are being implemented in the Philippines. However, even though we have these policies, during the pandemic, there were also published additional policies in waste management. Problems in implementation and monitoring these policies have been a challenge in the Philippines. So therefore, my call to action in healthcare professionals is to use our voice, because the climate crisis is a health crisis, and we need to contribute also solutions to the problem by prevention, being prepared, and decarbonize our healthcare, because we can be a societal leader in protecting the public and planetary health from climate change. And we must become proactive and collaborate with different sectors in order to ensure that we have a collective action. For the institutions, these are the call to actions, such as the renewable energy and invest in zero emissions in the buildings and sustainable travel and transport, and provide healthy and sustainably grown food, incentivize and produce low carbon pharmaceuticals, and implement circular healthcare and sustainable healthcare waste management. And lastly, establish greater health system effectiveness. While the calls to action for the government and policymakers is to establish green universal healthcare by integrating sustainability in our universal health coverage, we can also maximize telehealth, which started during the pandemic, and integrate climate smart healthcare services and infrastructure into emergency responses and pandemic preparedness, and address social and environmental determinants of health by establishing disease prevention as climate change prevention and vice versa, and reinvent the finance system to support healthy people on a healthy planet, develop healthcare sector-based residual management solutions, and lastly, invest in further research in climate and health innovation centers to deepen our emission reduction across all the sectors. So that's the last of my slide. I hope you learned a lot. Thank you.
Thank you very much, Dr. Mitch. Before we let you go, we have a question from the audience from Arjun Serene. So he asks, how can we implement the sustainable healthcare waste when we are using burn-based treatment technology? Do you have any ideas about this?
Okay, so as I mentioned a while ago in the slide, is that some of the countries in ASEAN countries are using incineration, right? So what I can share with you is what we did in the Philippines is that we have a law called the Clean Air Act, which bans the incineration or other incineration related technologies, which contributed a lot in sustainability. Now the fight is on the point of generation of waste in the healthcare system, because that could improve a lot. And what we are talking about right now is the sustainability and the different types of sustainability and procurement, which could contribute towards the sustainable healthcare waste management. So I hope I answered your question.
Thank you very much. I think that was a very insightful answer. So if anyone else has questions for our speakers, you may direct them using the Q&A function in Zoom, and our speakers will either answer them live or they will type their answers in for you. All right, so let's move on. We want to share a video with you on Project Share, or Sustainable Healthcare Waste Management in Recycling. So just give me a moment to share my screen. And I'll play the video for you. All right. So that was a pretty interesting demonstration of how waste is managed. So thank you very much, Dr. Michelle, as well. The second and final speaker that will be speaking in this webinar is Ms. Ruby Navarro. She brings 20 years of experience as an environmentalist clinical practitioner, serving as the infection control nurse in charge of vaccination rollout at the St. Paul's Hospital of Iloilo. She'll be sharing her experiences in leading the way, St. Paul's Hospital of Iloilo's journey towards waste sustainability in Southeast Asia. Welcome, Ms. Navarro.
Good afternoon, everyone. Am I loud and clear? Sweetie J.
Yes, you are loud and clear. Go ahead.
Okay. Good afternoon, everyone, and peace be with you all. So healthcare institutions are major drivers for climate change. So as we are very well aware with, we are at the healthcare comprises a total of almost 30% of the total Earth garbage. So when Mother Earth sends us a message, it is clearly urging us to call for an action. So the environment is made to suffer for all our wrongdoings. This is St. Paul's Hospital of Iloilo Incorporated. We are a Catholic healthcare institution and we are on the 112 years in healthcare ministry. So in its 112 years of existence, I am here to share to you our journey towards a greener and safer institution for our staff, our patients, and of course, the Mother Nature, the Earth. St. Paul's Hospital of Iloilo is owned and managed by the Sisters of St. Paul's of Shards, and we are located at the heart of the Philippines, where our main advocacy focuses more on the pro-life and environmental stewardship. Being the member of the Global Green and Healthy Hospitals, or the GGHH of the Healthcare Without Harm Asia, we are privileged enough to be guided with the 10 basic principles and goals of this organization. To top it all, we started our goals. We reached these 10 goals by starting it up with the waste. So our story started in 2019, where Sister Arcelita Sarniu has been assigned to us here in Iloilo City, St. Paul's Hospital, Iloilo. And it welcomes it welcomes her here in our institution are the big container van full of unsegregated waste. So approximately in our setting, it will cost us almost 3.6 million pesos. So this 3.6 million pesos is our wake-up call to emphasize and give emphasis actually on the waste management aspect in our institution. So we started it all by having it reorganized. So actually, we already have the Waste Management Committee, but reorganization of such committee and appointing persons that are dedicated enough to handle the challenge of this waste management is very challenging for us. So we started it up by choosing our staff. So we are privileged enough to have in our committee the infection control, of course, the maintenance and the engineering department, and we consider the nursing service department. So actually, we started it up with actually 4 or 5 heads, working heads. So we already have in place policy and guidelines for the waste management. But in 2019, we started it all with the policy on the not allowing the styro and plastics in our institution. Actually, this is a very big challenge for us because even the community is not very apprehensive for such policy, but we did it. We did it actually, and we started it all from the information dissemination to proper education to all our staff and all our patients. In 2019, actually, as we signify to join the Healthcare Without Harm, it was being introduced to us the waste audit. So the waste audit actually is our awakening in the staff, in my staff, like in the housekeeping department, to identify our waste through this waste audit. Actually, the first waste audit we conducted at St. Paul's Hospital, Iloilo, we found out that almost 60 to 70% of our waste generated in the institution are from non-medical plastic waste. Means all the waste that are from the community are comprises more of our waste here in the hospital, not just the medical waste. And of course, almost 20 to 30% of the waste, according to the waste audit we conducted in 2019, was the plastic and paper waste, medical waste containers, such as the products packaging. Actually, for example, the IV tubings, the IV packings we have. So through the waste audit, we have identified all the generated waste we have in our settings. So the result of the waste audit we have was being utilized for recommendation, and of course, some of the revisions for our policies and procedures. For example, we identified at that time that in the emergency room, there's a lot of plastic and paper food containers outside from food delivery. So what we did in our policy was we control all those food containers coming in our institution, so that we will minimize the waste that will be generating in our MRF. So by this, from the waste audit, we have all of our initiatives has been in place. So to start with, we have a strict implementation. When I say strict, we first educate our staff. We have inculcated in their mind that the segregation at source is very important. Not just segregation and sorting, but also the disinfection of all these waste at source. So the to follow after of the implementation is the no segregation, no collection policy. So we at the Infection Control and Occupational Safety and Health Committee always make sure that all our procedures and policies that are followed in the institution are guided by the legislations of the infection control and of course the occupational safety and health. So we labeled all the waste bins according to the segregation. For example, the vials are all vials, the needles are all needles separated with the syringe and the plunger, the ampules are all ampules, and of course the syringes are separated from its needles. The tubings, I forget. Then the cap of the tubings have been separated, and of course, all tubings that are with body fluids of the patient are separated. They are all disinfected before they will end up in the MRF. So the basic of paper, scans, and plastics are in the strategic areas of the hospital, and of course, in all clinical areas, we do the segregation actually properly. So the diapers are all diapers, all papers are papers, and plastics are plastics. So that when the waste will be dropped at the MRF, that's the final destination of the waste within the hospital. All the waste are segregated comprehensively so that it will be managed properly at the materials recovery facilities. So as you can see, all this garbage are beautifully segregated in this kind of container. So when it reach our MRF, the MRF in charge in there already been apprehended and knowledgeable enough where to and how to manage or deal with these kinds of waste. So of course, the safety is our topmost priority in consideration to all this implementation process. Other than that, we shifted from plastic to canned and glass bottled drinks in the canteen and the carry department. So we also fabricate our customized stainless needle cutters in lieu of the plastic hub cutters we have from the suppliers. So as we can observe, the containers of these needles, such as the hub cutters, are more bulky compared to we fabricate the customized stainless needle cutters, in which we produce only the needles only that was rich in our materials recovery facility. Everybody thinks that the materials recovery facility are dirty, something like that. But in our setting, our MRF could be, shall I say, the cleanest part of our hospital. It's because they are equipped with CCTV for those who segregated it wrongly. So they will be reprimanded. Actually, our MRF has 5 CCTV cameras for close monitoring to those who are not properly following the policies and procedures how to do the segregation. And of course, all these segregation bins we have are properly labeled so that when it comes into the materials recovery facility, they will just do the segregation per category of the waste. So in the end, the waste handler we have in there at the back, our bioman, will be the one in charge to do proper procedures how to do. For example, these plastic bottles and IV bottles are segregated separately. They are directly pulled out by our third party contractor for sale actually. Then of course the syringes, they are separated, the needles from the plungers, and of course all the papers are segregated accordingly, even with the color, the non-color and the white, the colored and the white papers are segregated accordingly. So we have 2 autoclave machines for all these infectious waste we have. So from the units, when they identified it's already all diapers, so all these diapers goes directly to the autoclave without even opening it by the principle of infection control. So these diapers, after autoclaving, we have a pilot testing before that we test all these microorganisms through culture, and we found out that there is no existence of microorganism after autoclaving all these highly infectious ones like the diaper, the napkins, the tissue papers from the yellow bins we have collected from the clinical areas. And of course, all our tubings and syringes are properly disinfected with 10% sodium hypochlorite before they will be dumped at the materials recovery facility. So of course, for safekeeping, we have shredded it into smaller ones using later on, I will just present it to you. So we have also the needle crushing. So we identified all the needles as all needles. So when we say all needles, there's no syringes nor plungers involved in the waste that reach our MRF. So the needle crushing per se is performed or done finely. So after this, the end product of the needles that was finely chopped or crushed was being utilized as aggregators, of course, for construction purposes. Of course, all the vials and broken glasses have been segregated properly. So it will be crushed through the glass and vials crusher. So these crushed vials and crushed vials and needles are mixed as fine aggregates with the cement used as in our construction sites. And of course, we also have the plastic and paper shredder. So all documents from archiving, in which that's 10 years and up, was being shredded through this shredder. So these papers, some of these are cartoons and somewhat like the others, before they will be disposed or to the third party contractor we have also. This is for sale. So the price of the crushed paper is much higher compared to those without the shredded paper, I guess. So everybody is very well aware that tarpaulin is very hazardous. The making of tarpaulin is very hazardous to the environment. So our initiatives here is since 2019, we are not receiving actually tarpaulin for advertisement purposes. So instead of, we use our electronic billboards, the big TV screens we have located all strategic areas of the hospital. So all necessary advertisements are being shown in this electronic billboards and the televisions located in our strategic areas. So, and of course, this costs much higher compared to the tarpaulin making, but we find it very effective and usable and earth-friendly using the cloth pulin instead of the tarpaulin. So just recently, we are accredited as ISO 901-2015. So we place our achievements in a cloth pulin. So these are for the external or outside advertisements we have. So all these plastic bottles and gallons are utilized as plant pots. So the latest building we have, that is the green building we just constructed recently, was our parking area. And this area has been strategically placed with plants and vegetables that are placed in this recycled plastic bottles and gallons for the pots, for the water and the soil to be held. And of course, we use the used plastic bottles, like the plastic bottles from the mineral water and the soft drinks or the soda. They are used as container for charcoal, as in place for geoderizer we have. So this is where the craftsmanship, our expertise in the field of arts are presenting, which we are showcasing this every activities we have in the institution, like Christmas, Valentine's, Earth Week. So we always have this recycling of all your waste from your specific unit or department. So you need to showcase something like a work of art, beautifully, meticulously done, for something like useful or work of art to be presented or to be exhibited in our lobby from time to time. So that's it. So the highlight actually of my talk is during this COVID pandemic. So being an infection control nurse, it's been a very big challenge for me actually, and how I will deal with the COVID pandemic without getting the environment mostly burdened with waste, and knowing that the principle of infection control are all disposables, are all not to be used again and not to be recycled like that. So the challenge is with me and my colleagues in this time of COVID pandemic. And this is the time also when we need to really initiate or create a sustainable program for such. So we create our own sustainable personal protective equipment without compromising our people's health and safety, and saving the environment for the threat of infectious waste to be disposed thereafter. So it's a challenge for us. From the choosing of the cloth to be used, the design, how to go about with the reprocessing, re-autoclaving, washing, something like that. So we studied it all from the start, from the choosing of the cloth, from the fabrication, from the making it out, until now, we're still using these reusable PPEs we have. So we created our own PPE using the gown type and the coverall type. So we also made our cloth mask, and inside that cloth mask, we initiate to place a disposable mask inside the cloth mask, so that the disposable mask could be used even for the 5 to 10 times, but it's very still safe because it's under the cloth mask we have. And of course, all these things are with approval with the Infection Control Committee and the Occupational Safety and Health, because they all process and they pass through our test, from the auditing to the culture and sensi of all these things that already been passed from the Infection Control Committee. So we projected our medical waste expenses on this time using the disposable PPE. So in calculation, we will be using the 12,000 sets of PPE. That's the cover all the disposable PPEs with our 30 non-ICU and 10 ICU COVID beds, plus the 30 beds isolation facility during those times of COVID pandemic. So the medical waste quantity from disposable PPE that's approximately 250 for 50 grams per PPE set. That excludes the gloves and the mask and the others, the tissue during hand washing, of course. So we calculated that we could spend as high as 51 million pesos for if we utilizes the disposable PPE for a year. And of course, with our reusable PPE, the cost, and of course, this is not just for the 51 million on purchasing of this disposable PPEs. The problem here sets after where will we dispose our disposable PPE. So the burden again falls on the waste. So the waste approximately we will spend as much as 2.6 million with the 51 million of the total purchase disposable PPE. So utilizing our sustainable reusable PPE using the taffeta cloth, we save as high as $43,000 savings for the PPEs utilized during the 2021 COVID pandemic period. So we cannot do away with the disposables, right? Because the government has been donating with us all these disposable PPEs. But being the one who handles this PPE, I am the one who is handling the PPE actually. I made sure that these coveralls will not go through our MRF. What we did was we wash it. We wash it with the use of the 10% sodium hypochlorite, and we set it aside for the meantime because I was thinking at the time that maybe in the future we could do something for it. So I collected almost 500 to 1,000 kilograms of disposable PPEs for almost 2 years, and they are all stored at our one of the storage area. And by the time comes that the COVID pandemic has been lowered, we created our initiatives of how we can reuse this used PPEs we have before. So what we did was we created our sustainable pouch and eco bags out of these pouches, and we utilizes these bags and eco bags, pouches and eco bags as containers for foods. And of course, the eco bags are utilized as bags for like shopping, like going to the market, something like that. So we produce as much as out of the PPE that we have gathered by that time. Of course, those PPE has been properly disinfected, dried, and of course, kept in a specific area. And of course, during these times that COVID pandemic has been lessened, the cases have been lowered. So activity sets in. So during this time, we are not into the fresh or cut flowers like that during some occasions. So what we did was all this used PPE was utilized, meticulously handcrafted to create a flower. So recently we used these flowers to decor our arcs for our Reina Elenas, the caro for the Santos we have, and of course we created a mini cherry blossom tree out of this used PPE we have. So it was been beautifully transformed into something that is a work of art that was actually been praised, and actually in the shortest mind of some people, you did it. You did it. Something like in this out of trash. Okay. going beyond the waste management committee, the recycling, the reselling of all these waste, we as infectious as the others, we infected the minds of all the people that surrounds us. By this time, we infected the minds of our doctors. So we created the HEAL. Actually, the HEAL program is, or the Health and Environment Advocacies for Life, are spearheaded by our pulmonologists, our doctors. They are spearheading such activities, useful activities actually, that pertains or advocates more on environmental stewardship, like this one, the Earth Week. So we launched it timely after the event here in Taiwan. So we launched our Earth Week through the launching of HEAL. They signify themselves to be a member of the HEAL program we have. So we garnered as much as 300 to 500 members already for the HEAL. And just recently, we are having our photo exhibit. The members of this HEAL committee, HEAL group, is having our exhibit here, showcasing the environmental friendly activities and the beauty of nature through the work of art. And of course, series of lectures concerning about the care for our common home. That's the Laudato Si by the Pope Francis, of course. So these are all activities that is within the hospital actually. And going beyond the four walls of St. Paul's Hospital of Iloilo, the committee also is spearheading our activities outside our institution. So we started it off with the ocean cleanup, the coastal cleanup, and more activities like tree planting, the mangroves planting along our Iloilo Esplanade, actually spearheaded by our administrator, Sister Arcelita. As you can see, the collection of garbage with the coastal of Iloilo City was being spearheaded by our beloved Sister RC. So you can see that really the advocacy focuses more, and the beauty of these activities and programs advocacies is not just focusing on the patient, the staff, but of course we are inculcating and we are letting our attending physician, our doctors, our specialty doctors to join us in doing such activities for the common good of our environment. Though we are in the healthcare, we could do something and we could do much for the protection of our environment. So we are on our way to zero waste actually. So all the activities of the healthcare without harm, we are going on our edge to join and having it by heart and sharing it with our fellow Ilonggos actually here, so that the advocacy will not be going into trash or garbage in the future. So we are on our way to zero waste management, hopefully with the help of the Healthcare Without Harm, the GGHH. And Caritas Christi Argent Nos, thank you very much.
Thank you very much, Ms. Ruby, for sharing the experiences that you have had with the St. Paul Hospital of Iloilo. So once again, thank you as well to all of you who have been asking questions using the Q&A function, as well as to the speakers who have been answering those questions in the chat. So if you have questions for Ms. Ruby or anyone related to sustainable waste management, please feel free to ask them. Our speakers will try to answer as many of them because we won't be having a dedicated question and answer session. So moving on, it's been great to hear about all these hospitals who have been adopting sustainable practices. But to comment on how we as a community can step forward, I would like to invite Ms. Cathy Junfiao, the Sustainability Officer from Healthcare Without Harm Southeast Asia. Welcome, Cathy.
Thank you so much, TJ, and thank you so much to our earlier speakers. So for the next steps of this webinar, of course, we don't want to share our best practices, but just put our best practices right there. what we want to do next is to share more of our best practices, especially in institutions and organizations that you have, or in the healthcare facilities that you have. We would like to share the best practices through mapping it out, and we will put it out in a social media campaign. So, for example, I will be sharing a video about Project Share. This is based in Indonesia. Let me share my screen. Let me know if you can hear the. Can you hear the sound?
You can.
Yep. Okay.
Project Share, Sustainable Healthcare Waste Management in Recycling, merupakan bagian dari program Green Hospital RSUD Ibnu Sina Kabupaten Gresik yang diinisiasi untuk mengurangi limbah yang dibakar di insinerator dan dibuang ke tempat pembuangan akhir atau TPA. Penerapan proyek ini dilakukan dengan pengembangan pusat daur ulang, pembelanjaan produk dengan kemasan yang dapat didaur ulang, serta peningkatan kapasitas sumber daya manusia untuk memilah limbah dari sumber. Sejak tahun 2018, proyek ini berhasil untuk mencegah limbah yang dibakar di insinerator sebanyak 1.081 kg per bulan dan limbah domestik anorganik yang dibuang ke TPA sebanyak 2.663 kg per bulan. Data terbaru menunjukkan bahwa RSUD Ibnu Sina Kabupaten Gresik berhasil mengurangi limbah yang dibakar di insinerator sebanyak 7% dan limbah domestik yang dibuang ke TPA sebesar 27,6%. Melalui Project Share, RSUD Ibnu Sina Kabupaten Gresik berkontribusi terhadap tujuan pembangunan berkelanjutan ke-12, yakni produksi dan konsumsi yang bertanggung jawab. RSUD Ibnu Sina Kabupaten Gresik menunjukkan tanggung jawabnya atas penggunaan suatu produk mulai dari pembelanjaan hingga produk tersebut menjadi limbah. Selain itu, rumah sakit juga berkontribusi dalam menciptakan lingkungan yang sehat di luar dinding rumah sakit karena sebagian masalah dalam pengelolaan limbah tidak saling dipindahkan ke tempat lain.
Okay. Let me see. Okay. So that's one of our best practices that we can share at the moment from Ibnu Sina Hospital in Indonesia. So we would like to map out more best practices. If you are members of the Global Green and Healthy Hospitals, or GGHH of Healthcare Without Harm, and if you are not yet, then we are very open to sharing this initiative by we have a Google form that you can answer. Let me just also share my screen for that so that you can see it. And it's already shared by our friends from SCPH in the link. So this is a Google form that you can fill out, and then so that you can share the best practices that you have moving forward. And we can also share that in our social media campaign. Thank you so much. Thank you, TJ.
Thank you very much, Kathy, for announcing the release of this social media campaign. And I highly encourage everyone, if your hospital has like sustainable healthcare practices, we would love to hear about it. And we hope that you will feature it on our social media campaign by filling the form that we have released in the chat. So we have finally come to the end of this webinar. Thank you everyone for staying for this long. Before we wrap things up, I'm honored to invite a renowned and experienced environment policy advocate, the Executive Director of Healthcare Without Harm Southeast Asia, none other than Ramon San Pascual, to share a few final words to close this dialogue. So Ramon, if you're there, we are all yours.
Hello, thank you so much. I hope you can hear and see me clearly. I'm in the Office of Healthcare Without Harm, Southeast Asia here in Quezon City, in Metro Manila. And as I was listening and intently on the presentations and few discussions this afternoon, I feel really proud and honored to partner with Sunway. Thank you for this opportunity, as well as for the opportunity of presenting cases and views from Healthcare Without Harm, from our member hospital in Iloilo to our work with the World Bank, monitoring the policy compliance of several hospitals in the Philippines in terms of waste management, including in the time of COVID. It only goes to show that the whole issue of healthcare waste is both a regional issue in the Southeast Asia, but much more a global one. And the only solution that can be presented is by trying to heal both the public health impact of waste as much as its own environmental health impact. And I want to just impress on three things as a way of closing this program. One, that waste management in healthcare can no longer be addressed by talking about waste disposal. It is too late when we think of how to better manage waste, when it is already in our trash, when it is already in our landfills, when it is already, even if it is segregated by the fact that is already considered as waste, should be viewed as a problem in itself. There was someone among the participants or the presenters that mentioned the circularity. I think this is one thing now that we should work on, no longer to think of how to better dispose our waste and how to sustainably treat our infectious waste, but rather at the onset, think about, do we really need to use certain materials in our own hospitals? And if we do, how can we make sure that it stays in the system for as long and as much as it can through reuse, repurpose, recycle, such that circularity is become a system in itself in many healthcare settings. That's one key point. And therefore, substitution of materials that we use at the onset and making sure that they are sustainable in themselves is part of reducing waste. And procurement should also be viewed as a way of reducing waste volume in hospitals, that is sustainable procurement. Secondly, that there is an ongoing negotiation for plastic treaty globally. And there's the round 2 just got completed last week in Paris. And it should be brought forward to the attention of the healthcare leaders, hospitals, ministries of health, such that we become active participants to the remaining processes that will be concluded hopefully in the next 12 or 18 months, when the UN Plastic Treaty is finally agreed on. By realizing and what this global treaty is about, and participating in it, then the burden of taking action from hospitals become more real, rather than it is imposed on us by a global treaty or by certain policies that were produced by the government. As healthcare workers, where healing is our prime calling, we should already act upon healing our own planet and therefore healing the people and the patients. So let's take part on this global plastic treaty and realize ourselves that the action ultimately would be upon each individual, each hospital, each healthcare system to reduce plastic pollution. And the third point is on the emission component of waste, especially plastics. And this was pointed out by certain speakers as well, that plastic waste is a climate issue in itself. And one very clear step to shy away from emission by individual or by institution is to avoid unnecessary plastics in healthcare. And we became so abusive of our own environment when we dispose so much PPE unnecessarily on the pretext of taking care of the COVID infection in the time of the pandemic. Many of our findings speak of unnecessary use of gloves, of masks, of face shields that could have saved more in terms of our own planetary health. So those three things, I leave it to all of us to remind ourselves that the work will never be over, and discussions like this can only become meaningful if we take actions now. So again, on behalf of Sunway, on behalf of Healthcare Without Harm, the RISE Alliance, and all the members of the GGHH, we thank you so much for this opportunity. Thank you, and have a nice afternoon.
Thank you very much, Ramon, for those remarks. This marks the end of our dialogue for today, but not our journey towards sustainable healthcare management. I hope that all of you found this session helpful, and I do hope that you will also share your hospital's sustainable practices to encourage a culture of embracing sustainability. So thank you very much once again. If you have further questions, please feel free to reach out to both us, the Sunway Center for Planetary Health, and Healthcare Without Harm Southeast Asia through our social medias. It is listed there in the form that you can find. You can also just search out both our names. It's quite easily found. And I hope once again that all of you will take part in this culture of sustainability. Thank you very much, and I hope to see you all again in the future. Have a great afternoon, guys. Bye-bye.